Foot and Ankle Group. I'm Jackie Tomlin, and with me is Dr. Patrick Nunan, our Midtown office podiatrist. Please remember, during our live broadcast, if you have questions, just write in and Dr. Nunan will answer your questions tonight before the end of the program. This evening, Dr. Nunan will be talking about bunions, corns, and calluses. Those foot problems can be unsightly and cause so much pain. Dr. Nunan, tell us about bunions, corns, and calluses and how they can be treated.
Well, I think that the first thing we need to do is make sure people know what a bunion is. A lot of people think that any type of bone growth or any type of little callus or corn is actually a bunion. And a bunion is actually a deformity where the first metatarsal moves away from the second metatarsal.
Now, Dr. Nunan, you've given us that, not legalese, that medical terminology. I think it's a bunion when I see that big growth coming out of the side of your foot.
But it's not a growth, it's actually the bone protruding.
Is that right?
The first metatarsal will start to drift, usually due to some mechanical problem in the foot,
Okay.
and it will start to go outward. And what we usually do is see that on x-ray. And as it goes towards the inside of the foot, the metatarsal bone, the toe bones, the big toe, starts to go the opposite way. And it will go towards the second toe.
So this is not something that just happens and protrudes, because I've seen a small one and then I've seen a big protrusion, so it gets worse over time?
Well, it can. In some people, it starts and stays in the same position.
Okay.
We do know from a theoretical standpoint, and biomechanically, that it can get worse over time.
Okay.
Now, a lot of factors go into it. The person's activities, their weight, the type of shoes they wear. Shoes can make it worse. Most of these are genetic. When you talk to the patients, usually mom's had them, grandmom, grandfather, somebody's having it along the line. So it is actually a bony deformity. So that's what we're dealing with when we see the bunions that are there.
So how do you get rid of it? I don't see a lot of people having the bunion removed. Why
Well,
is that?
first of all, it's the amount of pain. I've been doing this for 33 years, and one of my philosophy is if it causes pain that interferes with daily activities or the ability to wear normal shoe gear, then that's when they need to consider it. I always tell people a bunion, it's not like your appendix ready to burst. It's not like your heart ready to give out. It's not going to kill you. Worst thing it can do is make your life miserable and put you in granny shoes. But that's the worst thing that it's going to do. I've been amazed since I've been here in Savannah. I've seen more bad bunions that don't hurt people.
They don't hurt.
A lot of them don't. Sometimes it'll make me cringe when I look at their feet in the x-rays,
Yes.
but it doesn't hurt. And like I used to tell the residents and students I worked with is, we treat the person, we don't treat the x-ray. Okay? And people's feet don't read the textbooks. So just because something theoretically looks like it needs to be corrected, the first thing is, does it hurt?
Okay.
If it doesn't hurt, I tell people to leave it alone. But the ones that are hurt, there's always alternatives. I always give patients alternatives. They can do nothing, what I call benign neglect.
Okay.
And it probably will get worse over time. The second thing is they can do conservative treatment. They can wear wider shoes. They can wear shoes with a more rounded toe box, reduce the height of their heels, use padding around there. If it's inflamed, they can take anti-inflammatories. In some cases, we can inject it with a steroid to reduce any inflammation that's present. And those type of things, we can make orthotics that control the flattening out of the foot, which kind of slows the progression of it down.
So we have shoes here
Right.
that we can provide to the patient.
Correct.
That have just like the diabetic shoes, a deeper toe box.
Correct.
Okay.
Yeah. But one of the things that we get to is if it meets that criteria, there's pain and interferes with daily activities and the ability to wear normal shoe gear, then we start to talk to people about surgery.
So what's that like?
Well, there's so many different surgeries that you can do. There's probably about 15 different types or kind of off of that subtypes that we do. Not one bunion procedure will correct every deformities. Now, as technology's gotten better, there are a couple procedures that actually work better than the others in most cases.
Of course.
But you have mild bunions, you have moderate bunions, you have severe bunions. The worse the bunion is, as far as a deformity on x-ray, the more complicated the procedure to correct it.
Is this outpatient surgery or?
Yes, it's
will a person
outpatient.
be hospitalized?
No, it's outpatient. Even the more aggressive ones are outpatient these days.
How long are you out of commission? You know,
Again,
for a person that's working.
Yeah, it
How
depends.
long
I
do
mean,
they have to
it
be
depends
off
on the
work?
procedure. Some procedures they can go back within a week or two.
Okay.
So it depends on their job. Now, if they have a sit-down job, I've had people go back in 5 days. You know, they can prop their foot up at work and work at a computer or work at a desk. Other people, you know, they may be out if it's a more advanced procedure. They may be off of it from anywhere from 6 to 12 weeks.
Okay.
But again, it depends on how bad it is. And one of the things that we use for criteria for the procedures is how bad is the deformity on x-ray. There's different angles that we measure, different relationships that bone to each other. We've known over time from studies, the medical literature, which procedures tend to work better in which situation.
Okay. All right. Let's move on to corns and calluses. I remember that my mom had calluses. That's the one under your foot, right?
Correct.
Usually right in that pad of your foot.
Mhm.
So what causes those, and can they be corrected?
Well, most cases, corns and calluses are not a skin growth per se. There are some exceptions, but for the most part, corns and calluses are a friction phenomenon. Okay, so what happens is either person is walking differently, they don't have perfect mechanics, so they're loading more pressure on one bone versus the other. A bone may be out of alignment, they may have been born that way, or they could have had a broken bone where the bone settled in a crooked direct position.
Those high heel shoes that we wear.
Those don't
when we're
help
trying-
either.
that when we're trying to be cute.
Yeah,
that doesn't
yeah,
help.
no, it
Oh,
doesn't.
boy, okay.
And then
Everybody's gonna have calluses.
And then corns are usually found on the toes, and most commonly they're found in deformities called hammer toes, where the toe becomes crooked and bent up. Okay,
I've seen
and
that.
sometimes we'll see them at the tip of the toes too. And so
I've seen that. The tip of the toe.
tip of the toe, if their toe sticks straight down like this, they get what we call a claw toe because it's both joints that are actually affected. And so what they're doing, in essence, is they're walking on the tip of the toe instead of the pad on the thing. Just like your finger, there's that little pad there.
Yes.
They're having to walk on the tip of it, okay? And there's about that much tissue between the surface and the bone, okay? So if you take your finger and over and over and over like that, it's eventually going to hurt, okay? But if you keep doing, if what the body does, it will adapt and it will try to form a corn there, okay, to try to take the pressure off of it. But in essence, what it does is it makes the thing worse.
So then, from your description, more women have corns and calluses?
Typically,
than
yes,
men?
and a lot of it has to do with shoes, but men have them too. A lot of commonplace is the little toe. A lot of women, because of the way shoes are cut,
The pointy-toed
the
shoes.
pointy-toed shoes, it comes in and the little toe gets pushed kind of like this, and then that bone becomes prominent. And because it's prominent, it rubs, and over time that can cause a corn to form.
I saw it was like a little sock that we had
Mhm.
here in the office, and I inquired what it was, and they said that it was is it called a toe sock? That they
Well,
put on
it's
there,
more of
and
a-
it keeps it from rubbing your shoe.
Yeah, it's more of a gel sleeve. It's a toe sleeve, would
Yeah.
be the correct term.
Okay.
And because with corns, again, it goes back to, does it hurt? does it bother things?
So do you trim it and then put the little
Correct.
toe sock on it?
You can put the toe. There's different ones. You can buy ones that are, and most of them, the better ones are made of gel, but you can get ones of foam.
Okay.
The problem is the foam ones fall apart in a week or two.
Okay.
Whereas the gel ones will last a lot longer. That there's ones that have the sleeve where it kind of compresses down a little bit. It keeps the toe from getting swollen. There's also things that can be done to the shoes. You can get the shoes what we call spot stretched. You can go to a shoe store and have them stretch it just over the toe area. A lot of people make the mistake of getting the whole shoe stretched, and what that does is just give more room for the shoe to, the foot to wobble inside the shoe, and so they still have the problem.
But you can get.
But you can get what's called a spot stretch, and then that will create a little dell right over where the corn is, so it takes the pressure off of it.
Well, I understand the women getting the corns because they're trying to be fashionable.
Mm-hmm.
But the men, what are they doing with their? I don't see men with pointed toe shoes.
Well, you know what? We're getting just as prideful as the women sometimes with some of the shoes. But you think of things like cowboy boots.
Pointed toe.
Pointed
right.
toe. But you also see people with like steel-toed shoes. And a lot of those steel toes, they've taken a size, whatever they wear, typically like 11, and they've put a steel toe inside of it. And that really makes it a little bit shorter, it makes it stiffer. So if they've got the toe deformity already, where the toe kind of curls in, they can get that rubbing too.
One of the things that I noticed I know that we sell a lot of the Dr. Comfort shoes, and a lot of the guys have to wear steel toe boots.
Correct.
And a number of them bought shoes from us because they picked up the shoe, and even though it was the steel toe boot, it was light.
Correct.
Really, really light, much lighter than the ones they had bought. So we do sell a lot of those, especially to the guys that are working down on the docks, or some that are working in factories and have to stand in the factory areas. And so, don't think that you have to wear steel toe boots that are weigh 10 pounds. There's a much lighter version that have a wider toe box, as well as the steel toe. So that's great.
Yes.
Now let me see, on the corns and calluses, it's no way to remove them so they don't come back unless you change the kind of shoe that you're wearing.
Well,
right?
it depends. If again, and let's go to calluses, we talked about corns, is let's say on the rare occasion, and it's rare that I've seen, but a bone is out of alignment, either because of it's too long, it's too short than what it should normally be.
And that's no fault of our own.
Right,
that's just
right. Or it could have been a broken bone and healed in the wrong position.
Okay.
So what happens is, in some cases, you can do a procedure to elevate that bone. Okay? So it's not getting, now that's easier said than done. You have to be very careful, because you move it too far up, then you get one underneath one of the adjoining metatarsals.
Okay, that's why we want to come to you. How many years you have?
33.
Okay, so you ought to know what you're doing.
Yeah,
huh?
and so we tend to be a little conservative with that. Now we can do with calluses, we can do things with inserts, custom orthotics, with padding and things that reduce shear stress, side to side stress. And that can help with calluses. But people will ask, well, can't you just cut them out? Well, no, you'd have to cut it down to through the layers of skin, and then the patient, because on the bottom of the foot, would have to be non-weight bearing from 6 to 8 weeks. But then, see, if they start walking on it again, they still got the bony deformity, so it just causes it to break down even more.
Okay.
So there are exceptions. There's a thing that are called porokeratosis, which is more like a round one. That in some cases, they're able to do it. Now, one of the things that we offer now, and just started offering, is to actually use injectables. And it's more like one lady calls it giving pillows to your feet. And we picked this up from plastic surgery in dermatology, and what they do is they inject many things like they do in the face for to do as a filler, where people get the
Like
sagging and
Botox,
stuff.
the-
Well, Botox tends to shrink. This
Okay.
actually builds up. Okay, let's say you have a sunken area. You can fill that in and make it look fuller.
Okay.
Okay? It's the same principle.